Welcome to News Channel 11 at 5:30. I'm Sarah Diamond. Josh is on assignment. I'm joined live in our studio by Dr. David Kirschke from the Northeast Tennessee Regional Health Department as we continue our monitoring the coronavirus, asking the experts. Dr. Kirschke, thank you so much for joining us.
Sure.
We have a lot of information to get to. We want to get to as many questions as possible. First of all, we want to point out that the Virginia Governor, Ralph Northam, closed K-12 schools in the state for at least 2 weeks. What are your thoughts on that move right now?
Also, I can't speak to Virginia, but in Tennessee, we've been talking with our school officials quite a bit. Really, the trick is getting the right balance. You don't want to close schools too early, especially if we're going to have to close them for extended periods of time later, because then, you know, all the parents have to burn sick leave and babysitters and things like that. So we're really working on the right balance, and CDC has put out some new guidance about, you know, when is the right timing to do that. So we've been in discussion with education officials about trying to get the right timing.
It seems like it's a delicate balance. You don't want to do it too early, because then if more time needs to be on the tail end, then that's even more time that kids are going to be out.
It looks like it's more important to be out when you have widespread community spread of the virus.
Okay. And also, we just heard from Ballad Health moments ago about putting some strict limitations on visitors in hospitals. What are your thoughts on this?
Yeah, so we encourage healthcare, you know, whether it's long-term care or hospitals, to try to limit spread, especially to high-risk people. So people that are in the hospital are going to be higher risk, elderly, people with medical problems. So it's definitely reasonable for them to screen people for symptoms and keep them out and limit visitors.
A lot of people, of course, on social media talking about this. There is a kind of a new buzzword and with a hashtag, and it's called Flatten the Curve. And it's an effort to cut down kind of on the spike of cases of COVID-19, like Italy is experiencing right now. Why? And it seems pretty common sense, but tell us why this is so important to flatten this curve.
Yeah, so if everyone gets sick all at once, if we don't do all these community measures we're talking about, like especially personal things like wash hands, stay home when you're sick, if it spreads very rapidly, then our whole system gets inundated. So hospitals get flooded and overflowing, like sometimes with really bad flu years. You know, a lot of people out of work. So just day-to-day things get shut down. And then supplies also of personal protective equipment for healthcare workers run out, and you can't resupply. So, you know, the more we can spread it out over a longer period, the more controlled we can have, and it's just more recovery time in between cases for everybody.
That is true, and you can see this is a great graphic, that steep curve, that's with the cases,
that's what we're talking about.
Of cases.
Yeah, we want to flatten that out and extend it over a longer period of time, and it gives everyone a better chance to respond appropriately.
And to deal with it,